Good afternoon and welcome to the AJC Community Conversation on the coronavirus. I'm AJC editor Ken Foskett, and I'll be moderating today's discussion. We're going to hear from a terrific panel of experts today who are standing by to answer your questions about the coronavirus. Before I introduce them, I'd like to thank you all for joining us today. I'd especially like to thank you for submitting your questions ahead of time. That's made my job a lot easier. I'll try to ask as many of them as I can. During the program, you can also submit questions online through the chat feature of YouTube and Facebook. Our journalists are standing by to monitor those questions, and they'll get to me so that I can ask them later in the program. If you'd like to hear from a particular panelist, please note that in your question. All right, with that, let me introduce our panel today. Dr. Carlos Del Rio is Associate Dean of Emory School of Medicine and Grady Health System. He has a specialty in infectious diseases, particularly AIDS, HIV, and H1N1, better known as the swine flu. Welcome, Dr. Del Rio.
Thank you, Ken.
Dr. Patrice Harris is a practicing child and adolescent psychiatrist and the immediate past president of the American Medical Association. She has a specialty in the nation's opioid crisis, childhood mental health, and socioeconomic health disparities. Welcome, Dr. Harris. Dr. Sophie Lukachuk is a practicing infectious disease physician and president of the Infectious Diseases Society of Georgia. She also has 3 adolescent children in the DeKalb County school system. Welcome, Dr. Lukachuk.
Thank you.
Dr. Lynn Paxton, trained in internal medicine and is the Fulton County District Health Director. Over 20 years at the CDC, she was the spokesperson for the HIV prevention trials of pre-exposure prophylaxis, the resident advisor for the President's Malaria Initiative in Tanzania, and the Zika coordinator for the Center for Global Health. Welcome, Dr. Paxton.
Thank you.
Dr. Jeff Stone is the president of the Georgia Academy of Family Physicians and is a practicing family physician with Wellstar Medical Group. Welcome, Dr. Stone.
Thank you, Ken.
All right, let's get right to it. And your first question. Today, the AJC carried this front page headline: Georgia has the highest rate of new cases. That comes from the White House task force on the coronavirus. Last week, the AJC reported the previous week's task force report, which said that Georgia was, quote, experiencing widespread and expanding community viral spread. Dr. Del Rio and Dr. Paxton, what is community spread?
Lynn, why don't you go first?
Sure, I'll go first with this one. It's a pretty simple concept. We have different ways of describing spread and by their location. So, for example, if we say household spread, we're talking about infections that are transmitted between members who are living in the same household, like husband to wife, child to child, child to parent. If we talk about hospital spread, we're talking about transmission that happens between perhaps, patient to patient, or much more rarely, patient to provider, provider to patient. So it's based on where it happens. When we talk about community spread, we're really talking, to a certain extent, about everywhere else. We're talking about the transmissions that are occurring, be just out in the community that are not necessarily linked to the household, not linked to a healthcare setting, but are just, the transmission you might pick up from going to the grocery store or going to a bar or, being in a restaurant. So that's kind of a very rough way of looking at what community spread is.
Yes, I agree. And I think, Ken, also that I think about community spread when you have to look at an infectious disease that is transmitting easily outside the typical areas of high risk. And, both Dr. Paxton and I sort of have cut our teeth in HIV. And when I think about HIV transmission, we think about, certain activities and certain populations that may be at risk than others. But when there's community spread, for example, in sub-Saharan Africa, everybody, regardless, simply because they're sexually active, they have a high risk of transmission. So right now, what we're seeing in Georgia is that very high risk of transmission. You really don't know, okay, if I go here, I may get COVID or I may not get COVID. It really is everywhere. Is that ability that you have enough people infected in the community that your ability to encounter somebody who's infected is high enough that going out there could put you at risk simply because you're in the community.
Thank you. I should note for our listeners and viewers that the White House does not make the Coronavirus Task Force report public. Our journalists obtain those reports from sources, and you can read the full reports on ajc.com, our website. All right, next question, and this is directed to all panelists. What are the most common situations in which the virus is spread? Please be as specific as you can with real-world examples.
Well, I'll start with I'm not going to try to cover all of them, but I'm going to think about one specifically. And to me, we have learned throughout this epidemic that a lot of transmission occurs in close settings and when you have significant contact with an infected individual. And therefore, and when I mean significant, I mean higher than 15 minutes. So therefore, a lot of transmission actually occurs in the household. If I'm infected and I go to stay in my house and I'm with my family, it is likely that I'm going to infect other people in my family much more than I'm going to infect other people just because I cross them in the street. So household transmission is a major source of spread of this disease. And maybe somebody then can talk about other places.
Yeah, this is Dr. Stone. I think I can speak for one example that many of us already know about, and that's the church up in Cartersville, Liberty Square, that unfortunately their choir members really acquired the disease rapidly and quite prolifically among many of their choir, number one, and then some of the congregation. So you think about it in the terms of not only closeness, but duration, and maybe inoculation too, because there's a difference between talking to one another and singing or yodeling to each other. So I suspect that their inoculation was much higher. Obviously, the results were devastating to that church.
And the only other point I will make is certainly indoors poses a greater risk than outdoor activities. But here's the overarching point. Unless you are perhaps in the NBA bubble or perhaps in your own bubble where you're negative and you've not been in contact with anyone, there is no such thing as zero risk. So the issue here is try to do all that you can to minimize your risk. And certainly that means that, again, indoors poses a higher risk than outdoors. Being with others in closer contact makes you at higher risk, and certainly not wearing a mask brings you in higher risk of becoming infected.
And I would like to add also that activities that we do without masks, such as eating and drinking, and that's why nightclubs, indoor dining, and other venues where people come together to congregate and socialize, and they're not wearing a mask because of the nature of the activity, why they're there. Those are situations where there is a lot of spread of coronavirus, and we've seen that with super spreaders in nightclubs and certain and indoor dining.
All right. I think all of our listeners and viewers would be very interested to know each of your own personal protocols that you take when you go outside. And are there certain things that you just won't do in the current environment?
Funny, people ask me that literally, twice a week. Someone comes up and asks me that, and I can say that I do. I scan the environment practically everywhere that I go, and I make a decision at that point. Like, for example, my own personal things, I don't go to bars. I'm not going to go to a bar because, just by the very nature of it, it's loud. People pull off their masks so they can be heard. They're close. So for me, I try to avoid whenever possible indoor environments where people are almost by necessity very, very close to each other. I also have become quite stringent. I have walked out of restaurants or stores when I walk in and see that no one's wearing a mask and everyone's right on top of each other. So, I just basically try to take it. I urge people to, take a look at everywhere they're going, and they have to make that decision, at that time, whether or not they feel comfortable with going into a particular place. On the other hand, If I'm out and about and I'm taking a walk in the woods, I'm not wearing a mask. I'm by myself. I'm, not going to be infecting anyone. So you have to look, is there proper social distancing? And are other people wearing masks that are close to you? And, I can take all that into consideration.
For me, what is really, I wake up in the morning, I see how I feel. If I'm not achy, if I'm not virusy feeling, I then prepare my cup of coffee. If I can smell it, that's my rapid COVID test. I'm good to go. And that's my home rapid test for COVID. And then I put on my mask, and I have my car mask, right? The mask I wear to get from my car to my office, and it's a cloth mask. And then once I get to my office in the hospital, we have to wear either surgical mask or an N95 mask. So then, if I'm going to go see patients, I'm going to go around, I'm going to go to the wards, I put on my appropriate PPE, and I put on my N95 or my surgical mask, I put on my face shield, and I go on my daily rounds or work or whatever I need to do. And, I'm doing a lot of research in daily contact with COVID patients, and I've been very blessed not to have been infected up to now, but I think it's because I'm taking the appropriate precautions. I feel the hospital is a very safe place for me to be. Like Lynn, I get more concerned when I go to Kroger, when I go the other day I had to go to Lenox, and believe me, I thought I was going to one of the most dangerous places in the world,
Yes, certainly agree. Yes, I have dined on an outdoor patio in the middle of the afternoon on a weekday. But certainly, if I ever was encountered with a situation where there were more than 10 people, and even if they were wearing masks, I would probably leave, as Dr. Paxton said. So I have to tell you, I'm less comfortable going out, even on an outdoor patio, than I was about a month ago. So as Dr. Del Rio said, the first thing I do is get up in the morning and look at the community spread. And are we increasing or are we decreasing? And as you noted at the very beginning, Georgia is experiencing widespread infection rates. So certainly I'm less comfortable now than I was a couple of weeks ago. And that will always be my first start to determine what I'm going to do.
What I do, I've been at the hospital these couple of weeks. So basically, I wake up in the morning and I drive to the hospital. And once I get out, I put my surgical mask on. And like Dr. Del Rio, if I'm actually going to see patients, I wear my face shield and sometimes an N95, but always a surgical mask. I basically don't take the mask off except to eat lunch, which I do at my computer. And even if one of my colleagues comes to me to ask me something, to talk to me, I'll stop eating, I'll put the mask on, and then I turn to them and have our conversation. And the only time I really take my mask off is when I get back in my car and I'm all by myself. And then I come home, and then I'm not allowed to stop in the kitchen. I have to go straight to the bathroom, take a shower, and then my husband allows me to socialize within the house. But basically, if I'm taking a walk, I won't wear a mask. But if I'm in any other circumstance with people, I will be wearing a mask. I haven't gone to the mall since March. I haven't eaten indoors anywhere. I really have, that's it. If there are people, there's a mask. Unless I'm alone or in my family, with my family.
And Dr. Stone, you want to take a crack at what you do and don't do?
Sure, I'd be glad to. I'm very lucky to be a part of a health park that triages their patients by phone, triages them at the door with temperature and questions, and then gets triaged at the front desk of my business unit, and my staff sees them before I do. I feel like I'm in one of the most safest places on earth. But, I think Patrice said it best, there's never a certainty. There's always a possibility. So I wear a mask. I wear a face shield for all patients, regardless of their symptoms. Thorough washing and disinfecting. But that's my office. On the outside, I appear to be a little bit more relaxed, I think, than some of my peers, so that maintaining 6 feet, and if I know the people that I'm socializing with, that's key. Am I in good health? Are they in good health? Knowing and sharing the trust that they've been careful about triaging themselves allows me to enjoy an iced tea, 6 feet apart. Walking the dog, I don't really see a problem, but as has already been said, I scope the landscape. If there are a lot of folks without a mask getting close to me, I leave. It's just too many strangers who I don't have a relationship with. And so it goes with other activities that might be sporting events that might be as easy as golf or tennis. I've done both. I feel comfortable doing that. But we all understand each other. We know each other. And we also know enough that if our quarantine is sick, we just won't be there.
Terrific. Thank you. Dr. Del Rio and Dr. Lukashok, let's talk just a minute about surfaces. We had a question from a school teacher who is going to be back in class with her children and was describing all of the different things that children touch: pencils, pens, desks, chairs, blackboards, each other. And she wants to know how much does she need to worry about the surfaces for herself and for her children?
Well, let me just start by saying that one of the things that we've learned in this pandemic over the past several months is that we initially thought that surfaces were very important in transmission. Now we believe that surfaces are not that important in transmission. So I think that while I'm totally in favor of cleaning, I think we need not to go overboard and not to become totally crazy about we have to clean everything all the time. The most important thing is that you wash your hands, and the most important thing is that you don't touch your face. But I think keeping a place clean, it's important, but I think that surfaces are not as important in transmission as other things are. So if I'm going to put my resources in something, I'm going to put them in masking and in social distancing, and I'm not going to spend thousands and millions of dollars in Lysol and wipes and other things.
I agree.
I thoroughly agree.
We're all in agreement. Yes. Touching and surfaces really hasn't been shown to be the main way that we transmit coronavirus. It's really breathing, it's droplets, it's aerosols, it's people talking to you, breathing on you. So I think it's good to be clean, maybe certain high touch surfaces like doorknobs and areas that kids are touching all the time. Probably not a bad idea to wipe them down a few times in the day. The main thing is washing your hands frequently and not touching your face, and wearing a mask, of course, and a face shield is recommended.
Very good. You've both teed up my next question for Dr. Stone very nicely. Dr. Stone, I'm outside in my front yard. I'm 6 feet apart from my neighbors, and I'm enjoying a nice cold glass of iced tea. Mask or no mask?
The question assumes that you're in good health and that they're in good health. And assuming that you know each other because they're a neighbor, I think 6 feet is enough to avoid what I would call mouth rain. You know what that is. Again, if we're just enjoying a nice conversation and we're not singing as in a choir, enjoy that iced tea. But when you're not drinking it, when you're otherwise in casual conversation and proximity, mask up. It's not hard to do, and you prevent that mouth rain from spreading.
Same question. I'm walking my dog in the park where I might see people passing by.
Yeah, absolutely. I think that you have to maintain a distance. I would carry a mask with me. I'd certainly be prepared, because when you're walking the dog, you don't know who's going to. The dog may take off, another dog may come to you. I know of no dog-to-dog to human transmission. Maybe we can get some comments from our panelists, but I think that's one of the safest things that you can do. Let's get outside. I think it takes away the heebie-jeebies that we've all developed. I'd say take the mask, be prepared, move away from crowds that might just be unmasked, but enjoy the walk.
And how about that tennis game that you play, mask or no mask?
Again, do you know the players? Is it doubles? Is it singles? How far apart are you? I think that if you know everybody, if everybody has triaged themselves, and we know about the surfaces now, that if you're not too close to each other, you can use your choice. I know that I can't play tennis with a mask and enjoy myself, so I'd probably remain unmasked. and go to the tennis game.
Thank you. All right, Dr. Lukashuk, your 17-year-old is out with his friends at the park. He comes home and reports that one of his friends learned that a family member suspects coronavirus, has gotten tested, and is awaiting results. What precautions do you take with him and with your family now that he has been in proximity with that friend?
Well, first I would get more information from him, what exactly did he do with this friend? But if he did have close contact, I would ask him to quarantine himself in his room. And if he had any symptoms, I would get him tested. That's really, actually, it seems like such a simple question, but it is not. I mean, how do you ask a teenager to quarantine themselves? How do you make sure they do that? How do you get them to understand, that this is really a very contagious disease and that it can make certain people very sick? I'm trying to think if there's anything else. Basically, also, I'm trying to think if there's anything else I would do. Maybe someone else wants to chime in.
Well, I think in this scenario, the important thing that's been said is that your son learned that the family member of someone he was close to was exposed to the virus and is waiting results. So I would ask to find out what that original person's test result was, because if it comes back as negative, then you're done. And
right,
then if it comes
absolutely.
back positive, then you can go from there.
While you were speaking, Dr. Lukashuk, a question from the audience came in. Any further guidance on how to talk to teenagers about social distancing and what's appropriate and not for that age group?
I think it's important to talk to your teenagers about it, even whether they acknowledge it or fight back or tell you that they can't do it. At least try to talk to them and try to listen. I think a lot of times they will listen. I think you have to explain to them, that once again, coronavirus is very contagious, that you can spread it, even you can have it and be asymptomatic. You can spread it even though you're asymptomatic, first of all, because you may have it and be asymptomatic, or you may be incubating it and not know it. And I think it's also important to get teenagers to understand that even though they may not get very sick from it, they can pass it on to relatives, to parents or grandparents who could get extremely sick from it. I've heard my teenagers say, I won't get sick from it. Teenagers are somewhat self-centered. They don't care about other people. So, I'll try to teach them that it's not just about you. This is a community effort. This is for the whole community. It's not just about you. It's about keeping the whole community safe. And the other thing my son told me, which I thought was just so interesting, was he said, I don't know anyone who's gotten really sick with the coronavirus. And I think even though we all as doctors see people who are very, very sick with coronavirus in the hospital and ICUs, a lot of our young people maybe have not encountered someone who's lost a family member or whose family member has been hospitalized or put on a respirator on life support. So I do think we need to do a lot better in terms of educating our young people. I think that this is something that maybe, I don't know who exactly does this in the community, whether it's the CDC, whether it's the Board of Education, but I'm a big believer in education. At least we have to try to educate. I'm not sure what result we'll get on in the end, but we have to at least try to educate our teens and our young people.
I have to just jump in here just for a second, because Sophie and I actually have children that are the same age. And Sophie, I don't know if you remember, but we've actually known each other for a long time.
Yes, I do remember. The Ivory Coast.
So I have a 17-year-old, and I've done everything that Sophie did, but with one additional thing, which actually really worked. And I said, Katie, you need to wear a mask, because I want to spare you from the extreme guilt you're going to feel if you ever come back, you bring it home, and I get it and I die, or your uncle gets it, or somebody else, and all that. And I mean, of course she laughed at me, But I can say that I think it worked. A friend of mine actually happened to see her out with some other friends of mine at a store, and she was irate because her son was not wearing a mask. My daughter was. And I think that somehow that little bit of I'm keeping you from feeling really guilty helped.
You know, Ken, if I could, because I'm not a parent, but I, of course, work with parents and families as a child and adolescent psychiatrist, and that good old mom and dad guilt does work. But you know what? I do believe that, and you know, there is a serious side to that guilt, because I do think that if something were to happen to a family member, I do worry about how children and adolescents will feel and process that after the fact. And so I worry a lot about that. And so I'm a believer in that good old fashioned mom and dad guilt. And also I think using language that children, you know, both Lynn and Sophie have older adolescents. But, you know, I've really been impressed with Sesame Street and some of the work they've been doing to explain COVID and some of the things to do with younger children. So I think look for resources. The American Academy of Child and Adolescent Psychiatry has some great resources. So I think parents are doing a great job, and this is hard. It's a hard time to be a parent, but use those other resources. And of course, when all else fails, that good old fashioned mom and dad guilt.
I love that. Thank you. Yeah. All right. Next question for all panelists. We'll go alphabetically. When should I get a coronavirus test? Where should I go to get one? And what should I do while I'm awaiting results? Can anyone get a test, even if asymptomatic and haven't been exposed? Well, Dr. Del Rio, you'd be up first. Yeah.
I think there's a lot of questions there. And number one is the first question I would have is, why are you getting a test? If you have symptoms and you're getting a test, I think it's a very different situation that if you say, well, you know, somebody in my work was exposed and we were just learning about it today. I'm totally asymptomatic, but I want to get tested. I think those are two very different situations in which you want to get a test. So because it depends on how you get it, how fast you need the result, and what you do in the meantime, right? If I'm symptomatic and I get a test, I try to get a test as soon as possible. I want to be sure that I'm, you know, masked when I go to get a test. I want to get a test in the place I can get it right away, and I want a result fairly quickly. But in the meantime, while I'm waiting for my result, I want to stay home and isolated because I'm symptomatic and I want to not pass it to other people. Now, if I'm at work and all of a sudden I hear that, or I've heard for somebody, let's say, somebody said to me, like, you know, the au pair that takes care of our kids called today and said she was positive. What do I need to do? Well, everybody in the family feels fine, but what do we need to do? Well, I'd like to find a place where you can get tested. And I'm going to let Lynn talk about Fulton County, because we're not doing a very good job in Georgia testing, but Fulton County is doing a terrific job. And they have a great website that you can go. It tells you what places are open from what time to what time, whether you need an appointment, whether it's a drop-in place. And then, quite frankly, I'm sending a lot of people to those Fulton County places because they're really doing a tremendous job of offering testing. And the turnaround time now, it's about 2 days. So you can get a result fairly quickly. And therefore, you go get a test because you are concerned about yourself. And if you are concerned, you should go ahead and get tested. Now, you got to remember that a test tells you what happens then, right? I could be negative today, and then I'll say, okay, I'm negative, and then I go to the grocery store and get infected. So you got to remember that a test is not a test of immunity. It doesn't say you don't have it. You don't have it at that very moment, but you could get it later. So Lynn, how about your testing?
Well, yeah, that's everything you said is true. So let me just talk then a little bit about testing in Fulton County. At the very beginning of the epidemic, you really had to have a symptom. We didn't have enough tests. You had to have symptoms in order to get a test. That is no longer the case. Anybody can anybody can get a test should they want one. The way that you would go about doing that is, as Dr. Del Rio has said, you can go to either the state, the DPH website, you can go to the Fulton County Board of Health website, or the Fulton County government website. All of them have links to, you've got two options. One, you can, they have a link to, it's a web-based application that you can schedule your own appointment, and it'll tell you where all of the testing sites are, and you can schedule your own appointment. For those who are less technologically savvy or don't have access to a computer, you can always call our hotline number and you can schedule it that way. And it's a great system. And the reason why our turnaround times have now fallen from the nightmarish couple of weeks that they were a few weeks ago is that with this new system, you can schedule your own tests, so you don't have to spend as much time online. Once you are scheduled, the system will send you an email with a code. You take that code with you when you go to the test site. It is scanned. You stay in your car if you're at one of the car sites, or if you're at one of our walk-up sites, you walk through. You're quickly done the swab, and you can be in and out. We've timed it. You can be out in as little as 7 minutes, to maybe 15 minutes or 20, depending on how much is going on there. And then once the results are back, you can either check yourself by going to the web portal that's given to you on the paper that is given to everyone who comes by, along with instructions to self-isolate while you're waiting for your results. And so they can check on the web portal to see what their web results, and they will receive email telling them to go to this portal. Anyone who is positive, because this is a notifiable disease, we are sent notice of the health department, we receive notice of all the positive tests that are done, and then we track people, and then we will call people who have tested positive. So my last plug here is that if you get a phone call and it says like either Georgia COVID response, Fulton County Board of Health, anything that has COVID or health in that, please pick up the phone, because that's going to be somebody from my shop calling you to give you information that you want to hear, and then to basically to ask you about how you're feeling and ask you who you've been in contact with during that period of time that you were infectious, so that we can in turn get in touch with your contacts. So that's sort of that in a nutshell. You're muted.
Ken, you're muted.
Oh, sorry. I was asking if any of the other panelists, Dr. Harris, Dr. Stone, Lukaszek, wanted to add anything on the question of testing.
Yeah, I'll take a shot at that. This is Dr. Stone. I just wanted to let you know that, what we've done at the office, in part because of shortages early on, but because of what I call the curiosity factor that doesn't change outcomes, we've taken the approach of target testing. And there are lots of reasons to do that. But for the patient that comes in and said, I was really sick in November, it was the worst bronchitis I've ever had in my life, I need to know if I've got COVID-19. I can safely say that it didn't exist on planet Earth in November of 2019. So I discourage them. Others, once again, just have this generalized curiosity. But if it's not going to change what you do with the test, in general, I'm discouraging people from doing the test. It's been said already, we could do random testing on the entire population of the United States or the state of Georgia, but that only counts for today. What about tomorrow and the next day and the next week? We simply don't have the resources or the money to do that. So once again, I'm more along the lines of target testing. If it's medical legal, if it's appropriate because you've got to visit grandma just to make sure that she's doing okay and you don't want to bring her any kind of disease, sure, get the test. And think about the length of time between getting the test and what it's going to take to get to that contact that might put them at risk. So again, I tend to be one that favors target testing.
Yeah, and I'll say I practice at Kaiser, and we're testing in-house all people who are symptomatic. If you just need a test because you're traveling somewhere or because your job wants you to get a test, we recommend that you go to your local health department and get it there. Sometimes you can also go to certain urgent cares offer it. And I think that's it really. CVS used to, I'm not quite sure, Lynn, CVS, is that for all testers or just people who are symptomatic?
Yeah, they're still going by symptoms.
Symptoms, okay.
And Ken, I'll just add an overarching point, because I think that we need to just say this. And I know the viewers have sometimes been frustrated because for us, the physicians on this panel, it is not unusual we are comfortable actually with information coming out, as new studies come out, as the science comes out, and we may change our recommendation. But I believe for the general public, when I've been on these webinars in the past, have expressed some frustration with that. And so I think we can all understand that and want to say, though, that that is a part of the evolution of science. Understand the frustration, but also understand, I mean, I'll just take the mask, for instance. Of course, everyone will say that in the beginning, there was a recommendation, certainly not to wear mask, and now the recommendation is to wear mask. And I would ask everyone, we need to say absolutely yes. And the reason why is we had the resources and we had the further science that guided our recommendations on that. So I do want the listening and viewing audience to know and appreciate that just because the guidance changes does not mean it was wrong in the first place or that it is misinformation. That is the one thing that and we at the AMA are so concerned about, is the level of misinformation and disinformation that's out there. So I'm so glad, for one, that you all are doing this so that folks have an opportunity to hear information and hear it from credible sources.
Terrific. All right, I'd like to address the next question to our doctors who are actually working in hospitals, Dr. Del Rio, Dr. Lukashak, and Dr. Stone. What COVID symptoms should cause you to go to the emergency room? And what are you seeing in COVID patients who come to the emergency room?
So I'll start by saying that if you have, the key symptom is going to be shortness of breath. If you start having shortness of breath, if you have what we call dyspnea, which is, your inability to breathe, you feel like you're short of air, you feel like you're going up the stairs and you cannot catch your breath, that's the time to go to the emergency room, because that is the one concerning symptom that suggests that you have COVID pneumonia. And that's the one thing that we need to get you seen quickly. We need to check your oxygen saturation in your blood, and we need to decide whether you need supplemental oxygen and whether you need additional medical therapy or not by going into the hospital and getting IV antivirals or other medications. Before that, if you don't feel achy, if you got a headache, if you have, you lost your sense of smell or taste, you can stay home. There's no need for you to go to the hospital. And in fact, we want you to stay home. We don't want you to be in the waiting rooms at hospitals, and we don't want you to be in the bus or in the taxi spreading to other people.
I'll just second that. The most important symptom is shortness of breath. That's where you need to be in the hospital to get supplemental oxygen and possibly other modalities and to be monitored. Also, I just want to reassure a lot of people that the majority of people who get COVID recover on their own with just supportive care, fluid, Tylenol for fever. But then there is that small percentage of people who do progress to COVID pneumonia and to requiring supplemental oxygen and possibly even mechanical ventilation. So most people are okay staying at home. And when they are at home, they should quarantine themselves. But if you do feel short of breath, that's when you want to go to an emergency room.
Yeah, Dr. Stone, anything you would add on your end from your experience in an emergency room?
Oh, mute.
Muted.
Dr. Stone, you're muted.
Okay, sorry. Anything, this is my point, anything that would have brought you to the emergency room before COVID-19 should remain in place. We've seen too many people resist going to the emergency room for fear of what they might get when they get there, and as a result have sustained much more life-threatening heart attacks, strokes, medical conditions that have compromised them to a degree that would never have been done. And I don't know how we're going to capture that collateral data in the end as a COVID damage, but clearly I've seen it happen in my own practice. So if you have chest pain, if you have any kind of neurologic deficits, anything that would scare the bejabbers out of you before COVID-19, and you're short of breath or chest pain, go to the emergency room, call 911. don't hesitate. The place is triaged well. It's safer than the grocery store, and don't put yourself at risk just because you might get COVID at the ER. Thanks.
And
yeah,
if I can add to that, to what Dr. Stone said, and if you don't have shortness of breath, but you have symptoms of a heart attack or a stroke, you need to also go to the hospital, because what we've seen during COVID is people have not gone to get their care they need because they're afraid that they'll go to the hospital and get COVID, and therefore we have seen an excess mortality from diseases that normally we would have treated in the hospital. So don't be afraid of the hospital. If you have a medical condition, you need to go be seen.
Dr. Stone, I want to come back to you for just a minute about a question on pre-existing conditions and those that, in your opinion, put you at greatest risk from dying from COVID.
Yeah, sure. So this is still evolving data, and it's kind of interesting because we see a lot of correlation with age. I don't think there's any question that the older you are, the morbidity, mortality rates go up. But is it because with age you have an increase in some of those morbidities that include diabetes, respiratory conditions like emphysema, cancer chemotherapies, biologics that compromise your immune system? Those are all the typical things that put us at much greater risk. Some a little bit less than others, than really surprises. I mean, asthmatics are still at risk, but they seem to be a lot less at risk than somebody with emphysema. So we're working through a lot of those metrics, and is it correlative? Is it causative? This is a strange disease. It's a tough question to answer, but I'd love to hear what my peers think too.
I think diabetes and obesity seem to be playing a very big role in increasing your risks of severe disease, and hypertension, cardiovascular disease as well. But definitely diabetes and obesity, those people have an increased likelihood to develop severe disease.
And we certainly know that African Americans, the Latinx community, Native Americans are more likely to be hospitalized and unfortunately have higher rates of death. And again, very complicated and nuanced. And by the way, we should not be blaming anyone. Actually, I thought about this earlier about blaming and shaming whether or not they're not wearing a mask, or, we should try to refrain from that and have the conversations. But clearly, we should not blame people because they have diabetes or hypertension or have lived in certain circumstances, and that gets to discussions around the structural and social determinants of health, around racism and structural racism and unconscious bias, and whether or not you have access to health insurance and quality health care. And so, and also we know that the essential workers were overrepresented, if you will, by communities of color. So again, all of these reasons and factors are interrelated and certainly have added to a disproportionate burden on Black and Brown communities.
No, I think that's a really important point, Dr. Harris. But, I think what Dr. Lukashak said is also something that I want to emphasize. Diabetes, and in particular obesity, is an incredibly high risk factor. I read somewhere not too long ago that said that a 29-year-old with a BMI over 30 has the severity of disease equivalent to a 75-year-old. So, when we think about older people have a higher risk of severe disease, well, a younger person with a high BMI has as higher risk as somebody who's older. So that's the other thing that we need to remind people, that when we think about this epidemic and we really think about addressing this epidemic, I hope that we start thinking about addressing, social determinants of health. We need to get into really tackling diabetes, hypertension, obesity, which are major drivers of disease in our community. And we kind of not done a good job addressing them. And I think COVID will give us an opportunity to really not just take care of this infectious disease, but really think about what we need to do to actually prevent this chronic, quote unquote, non-communicable diseases, where actually are driving mortality non-communicable disease. So we can no longer make that differentiation between infectious and non-infectious and say, well, diabetes is different or hypertension or obesity are different. We have to address them, and improving access to primary care, improving access to healthy food, to exercise is going to be key in getting us into avoiding another COVID epidemic in the future.
All right, very good. We're going to take a quick 30-second commercial break, and then we'll be right back with more questions for our panel.
You start with one question, and then before you know it, you are involved in an investigation.
The Atlanta Journal-Constitution exposes how Georgia fails to protect senior citizens.
We're taking a look at the assisted living and personal care home industry.
A very close look at every facility in Georgia.
It was shocking.
Families had no way of knowing what's really going on.
Welcome back, everyone, and thanks for joining us in today's community conversation on the coronavirus. All right, I'd like to ask a sort of broader question. This may have been one of my favorites that came in from our audience, and it goes like this. If Georgia was run by public health experts instead of politicians, what actions would they have taken, and what would the pandemic look like now?
I might be asking
Dr.
to get myself
Del Rio.
fired.
I'd say, Lynn, you're on.
Lynn, no, actually, Lynn should not answer. We should all answer, and Lynn should not answer.
I would start by saying that the state should not be run by public health experts, because you need politicians. You know, politicians are there to make political decisions, but they need to base those political decisions in the sound advice of experts in the different fields, whether it's public health, whether it's economics, whether it's, you get your advisors, and you then, as a politician, you have to make decisions. I worry that as a state, as a nation, we're not following the science. And I think the key that I would say is that we are where we are as a state and as a nation because we have not followed the science recommendations the way we should have. And that is the problem. Politicians need to work with public health in order to get the best possible advice and then make the necessary decisions. But it almost seems like we have ignored public health and done what we think is best, but what we think is best may not necessarily be based on any sound evidence, and not following evidence is actually the problem.
Dr. Harris.
Go ahead, Sophie, and then I'll, yes.
I was going to say, that being said, I think that we should have stayed on lockdown longer. I think that public health officials would have recommended that we stay on lockdown until at least we see 2 weeks of consecutive decreases in new cases. And then we should have opened up the economy the way you turn a faucet, very, very slowly, not like flicking on the switch where all of a sudden all the lights are on and everything takes off, but more, in a very metered, graded way and with very close monitoring. And when we see that the numbers are upticking again, we have to back off and put in new restrictions. I think, of course, we would have mandated masks. This was done all over Europe, all over Asia. This is not rocket science. And I think it would have made a difference. And, I think those are just some very basic things that public health officials would have done. And I think it would have made a huge difference in where we stand today.
I absolutely agree. And I would say that I hope that physicians and public health officials and experts run for office, because I think that's a good thing. These are not mutually exclusive. And so that's something that I've been preaching for about 25 years. And I would say that I think that if public health officials were in charge, we would have been better prepared. And I think in all seriousness, we know, and I just want to state this explicitly, that public health, as well as mental health, those two systems have been so underfunded and under-resourced for decades. And certainly we need to make sure that, again, there will be time for after-action review. Right now we are in the acute phase still of this pandemic, but we have to be prepared. And I would say that I believe we would have spent the summer preparing and drilling and thinking about school. Because again, 3 or 4 months ago, we should have had a team in the room drilling tabletop exercise about school. And so those are the differences I think having public health officials ruling the world would have made.
Dr. Paxton, I think you were getting a pass from your colleagues there. Dr. Stone, do you want to add anything on how things might be different?
This is Dr. Stone. I'd just like to say that I think Kathleen Toomey, our Commissioner of Public Health, has done a tremendous job and has been on top of that website every day, sometimes a few times a day, giving us the statistics that really matter. It's been one of the 2 resources, the other CDC, that I've sent all my patients to. Get off Dr. Google and go to Dr. Toomey's website. She's done great.
Very good. So somebody alluded to this on we would have been locked down perhaps earlier and longer. Is it time to go on lockdown again? Are we at that point in Georgia, in your opinion?
It's interesting. That's a really good point that Dr. Lukashuk made. We, as a country, open up. We ended lockdown as a country when we were at about 38 cases per 100,000, when other places in Europe, et cetera, ended lockdown when there were about 10 or lower number of cases. In Georgia, we were even higher. So we were late to lockdown and early to open up. If you remember, even President Trump was not very happy with how early Georgia opened initially. Having said that, I think the lockdown was something we had to do to buy ourselves time to do the things we needed to do. I don't think another lockdown is necessary at this point. And I would refer people to the experience of South Korea. South Korea controlled their epidemic without having a lockdown, but they did it by enforcing mask mandates, by social distancing, and by really rolling out testing like nobody else did. I mean, they were way ahead of us with testing. So with the amount of testing we can do right now, if we really did testing well, we really did contact tracing well, we mandated masks, if we did all those things, social distancing, we would bring the epidemic down without a lockdown. And in fact, Goldman Sachs has said very clearly that if we got to 95% mask use, we could avoid a 5% drop in GDP that would be the cost of another lockdown. So the way to save the economy is by mandating masks, is by mandating social distancing, by doing those issues in public health that will prevent the lockdown, which will then hurt the economy.
I have made the same argument over and over to our board of commissioners and the like, and it seems like every week we're getting more information on that. For example, in South Carolina, just about 3 days ago, they talked about how the fact that 40% of their population lives in districts where masks are mandated. The rest live in places where it's not mandated, and there has been a 45% difference between case rates in those 2 areas. So basically it shows that mask mandates work. I do not believe that the political climate would really allow us to go into lockdown anyway. But I agree with Dr. Del Rio. I don't think that it's absolutely necessary. If people were to do this simple thing, if everyone wears a mask, if everyone social distances, if we do these things that we know that work, we can avoid going into a lockdown. We can get out of this prolonged, painful situation we're in right now with, we're not really bringing down the case rates very rapidly, but it requires a concerted effort. Everyone has to pull together to do this. And if that's the key, it's a public health problem. The public has to work in it together.
Yeah, so Dr. Paxton, sorry, go, Dr.
I just want to say very quickly, I agree also. The lockdown was when we didn't know a lot about transmission of the virus. Now we know what works and what doesn't work. And I feel like we can, masks, of course, are essential, and reimagining many businesses so that there can be social distancing. And so I think we can still open many sectors of the economy safely. I also think that there's certain sectors of the economy that cannot reopen, and I think we have to have restrictions. And I think nightclubs, bars, and like I said, those places where people congregate, I just don't think there's a place for that right now. I think there should be restrictions back in place. But many sectors of the economy have had to shrink because of COVID, but we have many other sectors of the economy that can open up safely. And we have many sectors of the economy that will be developed and that are new because of COVID. So yes, no, lockdown is not necessary, but we have to be very mindful how we open the economy.
So you all are addressing the issue of changing health behaviors. And the question is, how do you do that? So for example, around mask usage, where there is still a lot of disagreement about whether I should or shouldn't wear a mask, how do we promote a more constructive dialogue and understanding and compliance with people wearing masks?
Well, there's actually been there's a lot of work, scientific work that's been done around this, like how to phrase messages. Like, does positive framing work, like saying wear a mask and protect grandma, or the negative framing, if you don't wear a mask, you kiss grandma goodbye. There is all sorts of things, and it's been shown that it can work differently depending on who your population. So I've actually realized it's not a one size fits all approach. So we have to kind of look at the community that we're going to, and we talk to them, we figure out what's going to resonate in that particular community, because something that might resonate among, a primarily African American community in South Fulton might not go over well in Trump country. So I think you have to tailor these, how you broach it to your target audience.
I just want to add here, and I couldn't agree more. And in fact, I've been even, and I use the term, so I'm not being critical and include myself in this, but I'm not sure if we had a lockdown here in Georgia. Maybe you could argue that they had a lockdown in New York. And so I really like the term that Sophie used, and that's restriction, and that actually Lynn too, and it's targeted restrictions. And I think that messaging, consistent messaging is critical, but targeted messaging for your audience is also critical. And when we do an after action review, I'll just throw this out. I think we should look back at even using the term lockdown, but again, that will be for the after action review.
Very good. We've got flu season coming up. Doctors, what will be your advice on flu shots?
Get them.
Get them. I think we're all unanimous.
All right. Good. A question about the vaccine. Will a vaccine return life to normal, in your views? An effective vaccine?
I think it will certainly help. Nothing is 100%. I mean, we have a flu vaccine and people don't get it, and we are still admitted with the flu or catch the flu, or the vaccine is not 100%. There's a lot that we don't know about the vaccine. If we get a vaccine, how efficacious it will be. So maybe it will completely protect you against COVID. Maybe it'll give you partial protection so that you just have a very mild case. So I think it certainly will be positive, and I think it will help the situation, but I don't think life will be back to normal. And I think even if it's a great vaccine with great efficiency and with great uptake in the population, we have to be mindful that every 100 years there's a new pandemic, and we just need to be prepared for a pandemic. And it always needs to be kind of in the background that a pandemic could occur, that there can be some infectious epidemic that takes off, and that we need to be mindful of.
Ken, I agree with Dr. Lukashuk. I think a vaccine is going to be important. One or more vaccines is going to be a significant game changer, but it's going to still require that we continue doing the many of the things that we're recommending right now. I tell people we have a vaccine right now. It's called face mask. It's called social distancing, because it's going to take some time to vaccinate the number of people you need to vaccinate in order to get to the level of herd immunity necessary to really have community protection. So it's going to take several months to roll out the vaccine, to distribute the vaccine, to apply it to people in an equitable way and go to the most necessary. I mean, we're talking about millions of people that are going to need to be vaccinated. This is not a simple exercise. It took us many, many years with a very effective vaccine to eradicate smallpox. This vaccine is not going to be, it's going to be good, but it's not going to be super good. Vaccines against respiratory viruses are notoriously difficult to produce, and therefore the FDA is saying if we got a vaccine with 50% efficacy, that's good enough. So it's going to be a vaccine with about 50% efficacy, which is not 100%, right? So if you get the vaccine, half the people are going to be protected, half the people are not going to be protected. It's going to take some time.
And Carlos, we don't even know what's going to happen with coronavirus next year. I mean, we may get a vaccine for this strain of coronavirus, but, in a year or 2 years, the strain can mutate, the strain can change, and the vaccine may not be as good as it was a couple of years back, kind of like the flu vaccine. Every year we need a new vaccine.
I would urge communities of color, I know we have to go, but communities of color, Black and brown communities to volunteer, to get all the information they need. I realize the issues around trust, but do volunteer for the clinical trials. I think that will be helpful as we then decide who is best helped with the vaccine.
We're approaching the end of our hour, but let me ask one more question before we go, which is, where should people turn for information? What information should you trust, and what information should you be wary of?
There are a number of very, very good, reputable sites. I always direct people, of course, to the CDC website for coronavirus information. I also direct them to our own websites locally. The DPH, the Department of Public Health, has a very good website, as does the Fulton County Board of Health in Fulton County. Those are all reliable. What is not reliable is your next door neighbor's Facebook page, okay? Or what you saw on Twitter.
Yeah, I'd like to recommend familydoctor.org. Familydoctor.org even has a resource page dedicated completely to COVID-19, and it's in plain language, and anybody can go there.
I would say, Ken, that you guys, the AJC, has a really nice coronavirus webpage dashboard that I look at it frequently. So thank you for putting the information there for us in the state of Georgia. It puts everything there, hospitalizations, deaths, etc. I like the Infectious Disease Society of America website. They have a specific site, Coronavirus Resource Center, where you can find all the things from the clinical guidelines to other things, including podcasts and webcasts and other things. And this morning, I actually recorded a podcast with Dr. Fauci, which is going to be put there next Tuesday. And I think it's going to be really good. So I recommend people listen to it. So that's a good place to go as well.
And also the AMA website, it's mainly for physicians, but there's some information on there for the general public. But our JAMA, the Journal of the American Medical Association, and our editor-in-chief has really been doing some fantastic podcasts that are both appropriate for the physician community as well as the general public. And yeah. I like the Harvard and the Johns Hopkins websites as well, tracking websites as well.
But Ken, I will say that newspapers that are edited and vetted, such as the AJC or the New York Times, are an excellent source of information for non-medical people who want who want information that is vetted and true. And that would be my first recommendation.
And Ken, I would just say, it by saying that you guys have really done a good job helping us and others question, push the envelope. I want to personally thank you for a couple of weeks ago, putting the letter we had for Governor Kemp, that was signed with over 2,500 physicians across the state and other healthcare providers across the state. AJC has really been an incredible partner in getting information and in pushing Georgia to do the right thing. So thank you very much for that.
Thank you, and I'll go off script just a minute and say thank you on behalf of the AJC staff. I can personally attest to their dedication and how hard they have been working to help people understand the risks and what's happening in their community with respect to this extraordinary pandemic. I also want to let our viewers know that we're taking note of all the questions that you've put in, and some of these we've addressed in our coverage, and some of them we will address in our coverage. So stay with AJC for answers to your questions. Now I'd like to thank our panelists for taking their time to share their expertise, their personal experience, and their advice here today. And again, to our viewers, thank you for joining us. This was a public service event, and we owe a special debt to our subscribers. Because of your support, we were able to make this event free to everyone. Subscriber support makes local journalism and our reporting possible. If you are not a subscriber, join us. Go to ajc.com/subscribe and sign up today. Thank you, and continue to follow our reporting in the Atlanta Journal-Constitution and on ajc.com.